Hi, I'm Roberta, and today I am so excited to be having a conversation with Dr. Kathleen Mercer. Kathleen has been a naturopathic doctor for 20 years now, graduating from the Canadian College of Naturopathic Medicine in 2000. She actually worked in Ontario for a number of years before coming back to her roots, returning to Newfoundland in 2004, where she was the first licensed naturopathic doctor on the island. Today, we're going to talk a little bit about exactly what naturopathic medicine is and how it can really benefit all of us. So, Kathleen, thank you so much for coming to talk to me today.
Thanks for having me, Roberta. This is exciting.
It is. I'm so excited to have this conversation. Um, I think, maybe we should really begin at the beginning and have you explain to those who are watching exactly what naturopathic medicine is.
Right. So maybe I'll just talk about it through my journey of becoming a naturopathic doctor. I knew I was medical based at university. I knew I wanted to do something with medicine, and I wanted to go to med school, but at the last kind of minute, I decided not to follow that. And I went to Asia and started teaching English, but also got very interested in Chinese medicine while I was there. And then I thought, okay, I'm falling in love with this type of medicine and this philosophy of applying medicine to each individual and working with food and nutrition and herbs. And I found out about naturopathic medicine and I hadn't known about it. So I looked into it and came back to Canada and went to the Canadian College of Naturopathic Medicine. That's a 4-year program that you have to have a pre-medical degree first. And basically the first couple of years you're doing similar things to other schools in medicine where you're learning about diagnostics and disease and physiology and pathology. But the last few years are focused on applying things like nutrition and herbal medicine and Chinese medicine and Chinese medical theory and acupuncture, doing a lot of work with psychology and lifestyle counseling. And basically what happens is we meet each patient who comes in to see us. We get a long time with them. We get about an hour and a half with them. And it lets us really go over lifestyle and symptomatology and nutrition and are people happy and what their health history has been like. And then we get to apply a plan for them that whatever comes up, we're always dealing with nutrition and how people are eating. Maybe we'll tell people they should take certain herbs for certain things. Maybe we're doing a plan that has to do with physical therapy of some sort or some sort of counseling, and basically making a big, really individual plan for each person to get closer to the goals that they're hoping to get towards.
Wow. So you said nutrition there a lot. So it really is important what we're putting into our bodies,
It
huh?
really is the foundation. I mean, sometimes people come to see me and their diet's really terrible, and they say they've bought all these herbs and supplements at different places, and I think you just could have spent really good money on good groceries and learning how to apply that before skipping that part. Like, we can't skip the nutrition part. We just can't.
So now, of course, everything is closed down at the moment because we're in COVID-19. Are you still able to see patients? Are you seeing them remotely right now?
Yeah, so I mean, a lot of what I do is hands-on, but I can still see patients that I have with online visits. So that's still going on for people who need support during this time.
And I would imagine there's probably some common issues that are coming up during this time. I talk to a lot of people, and they seem to be, I think a lot of people are dealing with anxiety, for example, and just the uncertainty of what's happening in the world and when will we be back to normal and what's that normal going to really look like for all of us. So I'm just wondering if you're seeing sort of similar concerns coming from your patients.
Absolutely. And the other thing about it is we are really all going through it together. So even though I'm observing these things in patients who are getting in contact with us, I also am observing myself. I'm observing my family who are all with me. I'm observing, how my dad's handling it at home alone. I'm observing it through my friends that I'm in contact with. And I do actually feel like there are themes of what we're all going through for sure, even though we're all experiencing it individually. But I think the first theme was immune. So everyone was, of course, freaking out, very upset about what was COVID-19, what was going to happen to us, how many of us were going to get sick, what could we do to not get sick, what happens if we do get sick. So that was very immune-based, a lot of fear. And it's interesting because in Chinese medicine, fear is all in the chest and the lungs. So it's very thematic if you think about it, which I think you'd find interesting.
Mm-hmm. Absolutely.
So immune was the first thing. Then I think it was shock. I think everyone went into shock. And shock's a big deal. Shock really changes the way we think, changes the way we breathe, changes our functionality and our ability to task complete. So I think everyone was kind of going around a little bit like feeling very out of it for a little while. And then I think came realization and then fear about finances and about how am I going to get through? How am I going to get my groceries? Am I going to get paid? All of these things. And now I feel like then people got a little stir crazy maybe, or housebound or cabin fever. And now I think people are ready to change, ready to, hoping we can get back to some sort of new normal. But there also is a bit of anxiety that comes with that because we've had this opportunity to observe our lives and see what we don't like and what we do like. And some people have said to me, I'm kind of afraid to go back. I'm afraid to go back. So the one common thread through all of it is there's been anxiety and adrenaline. All the ones I just listed, all the phases, it's all been involving adrenaline and anxiety for sure.
So what are you suggesting? What helps with that? What can we do for ourselves right now to when we're dealing with that?
Yeah, I have a number of recommendations that I think are helpful. I mean, I'm a big person who believes in like key phrases to like ground us. And I think the phrase, it's okay to not be okay, is one that we should all stick to because we can compare ourselves to everybody else and say, what are they doing? What are we doing? But just recognize it's okay to not be okay. And I'm going to do my best today to get through. I think that's really helpful. I also think that, from a naturopathic point of view, there's a number of different things we can do to help our anxiety. And people can contact me or look at my website and maybe find some tips, but even some simple like vitamins and herbs are really helpful. And I'll just list three just easily. B complex, all the B vitamins in one supplement, really helpful to nourish our adrenal system and to nourish our system for anybody who is high wired or really, really busy minded, which is pretty much all of us right now. So a nice B complex would be great. Some really good calming teas like holy basil tea is really great. Chamomile tea is really great. And then there's other herbs that I think can be really helpful. Like I love the herb Ribes nigrum. It's one of my favorite herbs, and you can buy it in capsule or liquid form, and it's just or you could get it in tea. Just those types of things are really helpful. So there's a whole slew of ideas you can do from it actually taking something. But there are a couple of tips I've been telling people. I think it's really important to find order in the chaos because I find 24 hours or waking up in the morning and you have a full day without any schedule laid out for you, it can be really daunting. So I think that people should get a nice writing book, put it on their kitchen counter, and then maybe before you go to bed, write a bit of an outline of what you think tomorrow will look like and what you have planned, just a loose idea. And then when you wake up, you have that to look at because sometimes we can forget the plan. And then in the morning, you can kind of solidify it based on the weather, based on if what's going on with the people in your household. And then you can solidify that schedule a little bit better so that everyone in the household can refer to that. And you can refer to it, your kids can refer to it, your partner can refer to it, your extended family. I think that's really helpful, having like a guidebook.
That's amazing because my best friend, actually, she's home with her two children, and she and the 8-year-old did exactly that. They wrote a schedule of when her daughter would be doing schoolwork, but when, schedule time in for like recess or free play or whatever. Absolutely. And she found it amazingly helpful because it brought order, I guess, to the day.
Absolutely. And I think you could put meals in there, the meal planning that you're going to do. we have a chalkboard in our house, and we have taking turns of who writes the quote of the day on the top of the chalkboard. So, I mean, little things like that, because we're all in the house together, it's helpful. But meal planning is excellent. Getting the whole family involved in meal planning is really great. And for some families, this is the first opportunity they've had to do that. A lot of families are really busy. I've got 3 kids, and they're 16, 18, and 20. They've had busy lives and active lives. I think supper time is really important. I've worked really hard to have a supper time and we all eat together. But I know some families who say they've never sat together except Sunday at Nan's. So, I think this has been an opportunity for people to actually set the tables, cook together, and then eat together, and then clean up after. I mean, that hasn't happened for some people, which might be shocking, but it's very common. People don't eat together anymore.
It's true though, right? People are really finding togetherness in, I guess, sort of the quietness and being inside. And now, just recently, some of the restrictions have been lifted. So I wanted to talk a little bit about that, because that actually created a bit of anxiety in me in thinking, oh my gosh, it's almost over. Like in my head, I had 1,000 things I was going to do during this downtime, this period when I was in my house. And basically now I'm concerned that maybe I only have a couple of weeks left and I need to clean my entire house during that time.
Right. I said to you earlier, and I like saying this, is that I think people thought time was the obstacle. Why my basement isn't clean, why I haven't, gutted my closet. And now people are looking at their lives and realizing I've been home for 5 weeks and I didn't do those things. So people are starting to stress out because they're like, holy moly, I thought time was the obstacle, but now it's me. I'm the obstacle. So, I mean, I always say, give yourself a bit of a break. This is a wild time. However, in the book that I talked about, you could write out, what do I want done in my household or my garden or over the next month? And that gives you an opportunity to work with the weather and go, okay, tomorrow when I wake up, we are going to gut the linen closet together. Like maybe the kids or or your partner, whoever you live with, could do it together. And then bit by bit, just working your way through that list.
That makes sense because I find that I get everything accomplished better when I have a to-do list, whether that's my work tasks, my household chores, or even going to get groceries now, because I'm someone who normally would just pop into a grocery store maybe multiple times a week and just pick up what I needed. And now even that has become so different for me, where I'm planning, okay, well, what are you going to eat for a week? And all of a sudden it makes so much more sense. It makes my life so much easier that I hope that that's something I take with me back into post-COVID, is this just planning for meals and just making one trip to the grocery store a week, because I actually don't need to be there multiple times.
No, you don't. And it feels good, I think. A lot of people are liking that feeling. And I mean, we grew up, and you probably did too, in an era where there was grocery day. My dad did groceries on Thursdays. It was grocery day. And if it was gone on Tuesday and Wednesday, it was gone. There was no getting more. Thursday was grocery day. So I think a lot of people are doing that now and planning out their meals, which is a really good plan. Economically, it's a really good plan for just general order and time. I mean, how often do people say, okay, I'll drop into the grocery store on my way home from work? If you took that off, you'd save yourself 45 minutes, and we spend probably way too much when we do that. And we also probably pick the wrong food on the days we shop quickly. Like running into the grocery store, we grab this and grab that and grab some extra. And then we have too much, I think, junk food around our house when we do it that way.
Absolutely.
The other thing I think is funny about the grocery shop is that, and it's really everything, is being home and having this time. I think that, you can't hide from yourself. You can't hide from your behaviors and your patterns. You can't hide from the food you're eating. It's really making everyone have a little bit of self-observation that's probably a little uncomfortable, but it could also be really, really valuable for us to look at, wow, how do I eat? How do I communicate with the people in my household? How often am I cleaning or not cleaning? What am I avoiding? So it's a nice, I think it's an opportunity. It can be difficult, but it's an opportunity to look at yourself and maybe during this time make a couple of changes that your new normal we'll be healthier, more balanced, happier than the old normal.
Yeah, I like that. I mean, I do think this time has really stripped us down into, who we are when the world sort of stops. And I feel like people are doing different things here. Like I know some people who are taking the opportunity to really clean up their diet because they are shopping more consciously and they are planning food and you're not eating out all the time. And then I know some people who are sort of going in the opposite direction and they're using food, I guess, as a crutch or maybe they're drinking more than they like. But I feel like they're stressed out. So it's more of a reaction to that. And people have said to me, like, once I get back to work and stuff, I'm going to stop this. Yeah.
Yeah, I mean, that's the typical statement after Christmas, in the new year, after my birthday, after the summer. I mean, it's really, we can run away from the things we have to do for a long time.
Mhm.
And again, it's okay to not be okay. So anyone who really is relying on food and eating as a strategy right now, even if it's not super healthy, if that's what you have to do, it's okay. But and the other end of the spectrum is the people that are going to come out of this, they did learn a second language and their house is spotless and they did renos and every room's painted. I mean, there are those people too. I think the majority of people are surprised at the lack of task completion and maybe the lack of, oh, I thought I'd eat really well and I'm not, or I thought I'd lose 10 pounds and I've gained 10 instead. So
Mhm.
I think that's the majority of the people I'm hearing from. Yeah.
Yeah, my sister, I was talking to her recently and she made a joke about the freshman 10 will now be the COVID 10, that everyone's going to gain 10 pounds in this time. But, I guess we don't have to. And it does sort of come down to choice. And I'm someone, and people make fun of me for this, but I like to take a lot of vitamins. I really believe in supporting my body. And I know I don't always eat really well. So I'm a big fan of vitamins. So I take about 16 to 20 vitamins a day. So
Yeah.
I like hearing you say that you're a supporter of vitamins and vitamin therapy. Is that something, I believe it's something that you offer in your practice?
Right. So my goal as a naturopathic medical doctor is just, if I had an empty waiting room, I'd be really happy and successful because everyone I worked with was living independently on their own, knowing what to do. So that's my goal. And when I do prescribe a lot of vitamins or minerals or supplements for people, I always say, this isn't my take all this and you'll be great. It's a let's get a job done and then we're going to switch away from that and go on to something else. So I do recommend vitamin and mineral therapy for sure. And my goal is that we can get a person to a maintenance where they're not taking too much. This time right now with all that's going on, I understand we're all taking a lot. And we tend to take more in the winter in Newfoundland than in the summer. People say, well, I get enough through my nutrition. And it takes a lot to get everything we need right now from our nutrition. We get enough to live, but we don't necessarily get enough to use these vitamins and minerals therapeutically to do all the other work. So that's why we take supplements as a therapeutic plan. And we do right now as well give high dose vitamin C IV therapy at our clinic, which is really great.
Wow.
People who really need high doses for different things. So that's been really, really helpful. And just even talking about vitamin C, people will say to me, well, I get enough vitamin C. I have an orange a day. And I always say, well, that's 60 milligrams. And that's awesome for vitamin C. But usually a daily dose would be at least 1,000 milligrams, even just to take via capsule.
Right.
Yeah.
So I sometimes take 5, 7 capsules a day, but that's okay. People tell me I'm wasting my money, that you only need one. Why are you taking 6? But
Right. Well, you've been doing this for a while and you know your body and you know how you feel when you take different things, Roberta. So
Mhm.
that's great because we, as well as naturopathic doctors, we're doctors as teachers. We really hope to teach our patients to know what works for them and to get in touch with their body to go, does this food feel good for me? Does it not feel good for me? Does this person feel good for me or not? So the fact that you're taking this protocol for yourself and you feel positive and healthy about it, then I think, and then reflecting with someone outside of yourself every once in a while, a professional, to check in with to make sure you haven't lost the plot anywhere, you are wasting, right? Maybe you are, and we could say, hey, you're doubling up there. You could change that product to this product. But in general, and you know how you feel, and you're doing great.
Awesome. I want to refer back to something you said earlier about sort of affirmations, because many years ago, maybe, I don't know, a half dozen years ago, I went to see my doctor and we ran some blood work. I like to get checked every couple of years. There's diabetes in my family and other things. And this doctor has known me since I was 17, so quite some time. And I remember asking if he had gotten my blood results back, and he looked down and like I said, he knows me well. And he said, wow, he said, you are astonishingly healthy. And that is something that I say to myself a lot. It's
There
like,
you
if
go.
you believe it, then
Good.
maybe you
That's a great
become it.
statement. That's really nice. You are astonishingly healthy. That's great.
Yeah, I absolutely love it. Um, so back to naturopathic therapy, though, you also offer other services besides vitamin therapy, and I guess I almost want to call it counseling or expertise and advice with respect to diet and nutrition. So I'm just wondering if you can give us some more information about what you offer.
Right. So, as naturopathic doctors, we also are trained all our 4 years through in Chinese medicine and acupuncture. So we might see a patient and think, it'd be really nice to balance your system, as well as the other things I've told you to do for your homework. If you book in for a number of acupuncture treatments where you're using small needles, acupuncture needles on different meridian points in the body to either increase energy or take away energy from that organ channel. So it's really helpful. It helps for physical pain over an area, but also sometimes someone might come see me for migraines and they're getting needles in their ankles. So, it's not just about local treatment. It's about what area of the body will help influence the other area of the body. So I love acupuncture. It's really great. I also do, as an elective for me, I chose craniosacral therapy, which is a hands-on therapy that helps balance basically the craniosacral space, or the part around our brain and all down our spine, that gel that helps our body, our bones not bang off each other, basically. And we can really help to balance that for people. Really helpful for people with long-term stress. Really amazing for concussions and any motor vehicle accidents when the body's been shaken. And it's
Wow.
lovely. It feels good. You're lying on a warm table, and I'm just gently doing maneuvers on your spine and your head.
Oh, I think that I would like to sign up for that, actually.
Yes, you should try it. It's really lovely. It's really lovely therapy.
Wow. So, Kathleen, if someone wanted to get in touch with you or book an appointment with you, how can they find you?
Right. So my website is Health for Life NL, and you can find us there. I work out of Winter Home Wellness Center in St. John's, so you can find us at Winter Home or on Winter Home's website as well. We have a Facebook page as well, and our website really would direct you anywhere to find. And we put information on our website too of just things that are coming up that are thematic, different seasonal information that people could be doing to change what they're doing for their health during the different seasons is helpful too. And with naturopathic medicine, I love the catchphrase that our association puts out, which is medically trained and naturally focused. I think that really helps solidify, what we do as naturopathic doctors in Canada.
I like it. I like it. Well, Kathleen, thank you so much for taking the time to chat with us today. It was really wonderful.
Okay, great. Good to see you, Roberta. And thanks for the opportunity. I really appreciate it.
You're welcome.